This video is going to cover section 13.4, which is on disorders of the urinary system. We'll first look at disorders of the kidneys themselves. Kidneys are essential to life, and with kidney disease, then nephrons can become damaged, which results in decreased glomerular filtration rate and eventually then kidney failure. If nephrons are destroyed, then urea and waste products will accumulate in the blood, a condition referred to as uremia. You can also get to retention of water and salts without proper functioning kidneys, which causes accumulation of fluids in the body tissues, a condition referred to as edema, which will also result in imbalances in ion concentration, which can then lead to loss of consciousness and heart failure. So we definitely need to take care of our kidneys. Pyelonephritis is an infection of the kidneys, and it usually results from infections of the bladder that have spread up the ureter into the kidneys themselves. And this is generally treatable with antibiotics if diagnosed properly and promptly. Kidney stones are very hard granules composed of various materials like calcium phosphate, uric acid, protein, and they form in the renal pelvis. It's thought that a diet high in animal protein contributes to their formation, but I think the connections are not all that strong. They can be passed in the urine if they're small. Large stones, however, they can block the renal pelvis, which causes a pressure buildup that can destroy nephrons. Um, the larger stones, they can often be broken up with lithotripsy, which is a treatment involving ultrasound waves that shatter the larger stones into smaller fragments, which can then hopefully be passed in the urine. As far as treatment options for kidney failure goes, you really just have two options, either transplant or hemodialysis. And dialysis is the diffusion of dissolved molecules through a semi-permeable membrane. And this is a very time-consuming process. And um, patients who require dialysis, they have to give up many hours in their week in order to have this process done through a dialysis machine. They would need to go in several times per week, and the process lasts for several hours each time. So again, we need to take care of our kidneys. So disorders of the urinary bladder and the urethra. Infections are the most common causes of problems with the bladder and urethra. Urine that leaves the kidney, it's generally free of bacteria, unless, of course, a person has kidney infection or pyelonephritis. So that means then that the urine flow is one way from the bladder to the urethra. And so harmful bacteria from the urethra can sometimes gain access to the bladder. More common in females because females have a shorter and a broader urethra than the male. Usually results in inflammation of the bladder, referred to as cystitis, and once again, usually can be treated with antibiotics. And you can see in the diagram here, um, it points to the urethras and compares the male and female. You can see how much shorter it is in the female, which allows bacteria to more easily gain access to the bladder, as opposed to a much longer urethra in the male. So the likelihood of that occurring in the male is much smaller. Bladder stones, these are hard granules that commonly occur as a result of a condition that interferes with urine flow, for example, bladder infection or enlarged prostate in the male. Can form from kidney stones that pass into the bladder and become larger while they are in the bladder. Also can be removed surgically or also by lithotripsy, which again is ultrasound treatment, which breaks up the larger stones into much smaller ones, and again, hopefully they can then be passed through the urine. Bladder cancer is the most common type of cancer that affects the urinary system, and once again, smoking quintuples the risk of bladder cancer, and that's due to the toxic byproducts of tobacco that are secreted in the urine. So if you didn't have enough reasons already not to start smoking or quit if you do, then here's another one for you. And treatment usually requires removal of the bladder. So that covers the some of the basic disorders that we're going to look at, and that will end our look at the urinary system.